Today we will be demonstrating IV Piggyback.
I'm going to check my MAR and notice that I am giving Kefsol 250 milligrams in 50 mLs of 0.9 normal saline to run at 100 mLs an hour. I'm in the bedroom. I'm going to wash my hands and put on my gloves. And gather my supplies. So for this, I will need a syringe with a needle, secondary tubing, a label for my medication bag, a label for my tubing, alcohol swabs, and my drug book. I'm going to go ahead and pull my medication from the Omnicell. And it is cefazolin 250 milligrams per ml, which matches the MAR. And I am also going to need my 0.9 normal saline and verifying that against the MAR is correct. I want to use my drug book or a compatibility chart to make sure that the Kefsol and the saline are compatible. I can also verify that they are compatible with the infusion that's already running on the patient. First thing I'm going to do is clean my Kefsol vial for 15 to 30 seconds. Take my syringe. And I need 1 ml, so I'm going to pull back for 1 ml of air. Insert the air and draw back the 1 ml of medication. I'm going to make sure that I don't have any air bubbles. Now open my saline. When I open this, I'm going to check the expiration date. I'm going to make sure that the solution is nice and clear. I'm noticing that I have 2 ports. This is where I will spike the IV tubing, and this is where I'm going to insert the medication. I'm going to take another alcohol swab, clean off the port for 15 to 30 seconds, and then take my medication and insert it into the bag. Throw my needle on the sharps, and I'm going to gently mix the medication. I don't want to shake it, just want to kind of roll it back and forth. So now I'm going to pause and make sure that I have the correct medication. I am using Kefsol cefazolin 250 milligrams per ml, which matches my MAR, and I have put that into 50 mLs of 0.9 normal saline, which is what it says here, and I'll infuse this at 100 mLs an hour, so I'll have to calculate a drip factor. For your skill, we do want you to calculate the drip factor and show us the math that you use to get the rate. So now that I have this complete, I'm going to go ahead and label my bag, make sure that I have the patient name, room number, the drug, the concentration, my initials, and the date and time. I'm going to put this on the back of my bag so that I can still see on the front that it is the normal saline. I'm going to take my supplies and I'm going to head over to my patient's room. Now that I'm in my patient's room, I'm going to verify their name and birth date using 2 identifiers. I'll ask the patient their name and birth date, and I'll verify that with their name band. I'm also going to verify their allergies with them. And I'm going to do my 3rd check on my medication. I am verifying that I do have the cefazolin 250 milligrams per ml, which is what it says on my MAR, and that I've added that to my 0.9 sodium chloride 50 mLs, and it will run at 100 mLs an hour. I'm going to go ahead and take out my secondary tubing. These bags typically have a perforation on the edge to make them easy to open. In there I have a hanger and my tubing. And I want to check my tubing to make sure it looks good, there's no kinks, and I want to clamp it before I spike. At this time I'm going to go ahead and remove this cap and remove the cap from my tubing, making sure that I'm not touching any part that's going to go into the bag because that needs to remain sterile. Push that in there. And then I'm going to connect my secondary tubing to the primary tubing at the top port. So I want to take an alcohol swab and clean that off. Again, 15 to 30 seconds. I can unhook this and put that in, kind of push and turn. And then at this time, so that I can back prime it to fill this, because there's air in here and we don't want that, I'm going to keep this bag lower, and I'm going to very carefully unclamp my secondary tubing. You don't want to do too much because it will fill quickly and then you'll ruin the concentration that you already have in the bag. So as long as it's lower, you can see that it's dripping from the primary, starting to fill the line here. And I'm going to fill my drip chamber about half to 2/3 full. That looks good. And then I immediately reclamp it. This time I can hang my secondary up here. And because we want the secondary to infuse now, we need to lower the primary. So we'll hook that onto our hanger. At this point, we can then open up the secondary and we will calculate the drip rate by using the clamp on the primary. When you do this, you want to make sure you're looking here because this is what's going to be dripping. These are the drips that you are going to count to get that drip factor correct. So you'll alter the clamp down here on the primary, but watch the secondary. Last thing I want to do before I leave the room is make sure that I do have a sticker on my secondary tubing as well, so that we know when to change that. And that completes the skill.